Hi, everyone. Good evening, and welcome to our first in a series of events with Dean Begg. I'm Jennifer March from the Alumni Relations Office at Columbia School of Social Work, and myself, along with Associate Dean Stacy Cass, will be your moderators for this evening. As a reminder, and I know you saw it as you logged in, but this program will be recorded so folks can watch it at a later date and time. Tonight, this program will feature remarks from Dean Begg regarding the school as it relates to topics of national interest. This will be followed by a conversation with our newly tenured Associate Professor, Carmela Alcántara. Before we start the main event though, I'd like to cover some housekeeping items. First, you can speak with other CSSW attendees by using the chat feature. If you'd like to try it right now, you can enter your grad year and the state or country where you're joining us from. And we'd love to see you using that feature and connect with each other as the program goes on. Questions for speakers. They can be entered by using the questions feature at the bottom of your screen. Questions will be answered during the Q&A portion of the program. We will get to as many questions as we can this evening. Note that your attendee microphone is muted for the evening, and it will be that way throughout the event. And now I'd like to introduce Dean Begg, who is our Dean of the School of Social Work, as we all know. Dean Begg took the helm of the school in September of 2019. She is a population scientist with 30 years experience with long-standing commitment to developing the strongest possible evidence base for human health and well-being. Dean Begg, over the last 15 years, has focused on convening interdisciplinary teams, developing innovative curricula, creating mentorship programs, and enhancing diversity in the research workforce. Welcome, Dean Begg.
Thank you so much, Jen, and welcome to everyone who's here. I'm so glad you've been able to join us today. I hope you are all well and weathering the pandemics all around us as well as possible. I know that some of you have been very deeply affected, and I just want to say we stand with you as one community. For our event today, I'm looking forward to a very rich conversation with a truly wonderful colleague, Dr. Carmela Alcántara. Before we dive in, I would like to take a few minutes and tell you a little bit about latest happenings at the school. I have been in my position almost 11 months now and coming up on that 1-year mark, which prompts a lot of ruminating about what's happened over the past year and thoughts about the future. So I'm going to share some of that with you. I have to start by saying that we've all faced so much over the past 4 or so months, starting with COVID and the economic and social damage that has been caused by the lockdown, incidents of anti-Asian and anti-Asian American discrimination, the virus's disproportionate impact on communities of color, and the rampant anti-Black racism that has prompted significant protests around the country and around the world. This is definitely a remarkable time. But given the profound societal challenges that we face, it's clear that it's also a crucial time for social work. I can't think of any discipline, any calling, that would be better suited to addressing the crises and challenges of the current moment and their long-term effects, because I think we all realize that these effects are not going to be short-lived in nature. I'm going to take a step back in time for a second and think about the fall semester. Fall semester gave me a great opportunity to get to know folks. I got to meet individually with a large number of our outstanding faculty and staff. I also had the pleasure of meeting with student groups, most notably our student union, our student elected representatives, as well as a great many alums who are doing outstanding work out there in the world. It's really impressive. I have been just so moved by the commitment of everyone I've met to social work's core mission of promoting social justice and maximizing human potential. Furthermore, this listening and learning tour I've been on has enabled me to get an even clearer vision of the school's significant strengths and lots of opportunities. And in particular, I've been focused with my colleagues on building more and more interdisciplinary partnerships, both within the university and beyond it, with a view to amplifying our impact. And then came the spring semester and the arrival of the coronavirus, which has impacted just every aspect of our operations. The very first step we took when COVID arrived was to create a special task force to respond to it. And we had to get the right folks around the table. And initially, we were meeting daily, sometimes more than daily, just to get a handle on what's happening, what are the consequences, what are the implications, what do we need to change, what do we need to modify, what do we need to discontinue, and how do we execute on our vision. With remarkable agility, our instructors and deans and students moved the school to fully online teaching, and they expanded remote field activities. On-site research projects were also transitioned to virtual platforms or temporarily suspended until we could continue them again. All of our faculty and staff have been able to adjust to remote work really effectively and new ways of engaging. And let me add too that our students from the spring semester gave us very high ratings to their spring courses and to their instructors, which all had transitioned to remote learning. And that was just an amazing thing to see. It's been challenging, to be sure, but also incredibly heartening to see the dedication and ingenuity that have been on full display around our campus. I count myself incredibly lucky to be part of this community. On an intensely sadder note, I know that too many members of our community have suffered personal losses due to the virus, including the tragic loss of one of our own students, Susan Chuang, who is deeply missed here. Also, many of our students face even greater financial challenges due to COVID and its consequences. With the help of our online community, our alumni community, we were able to establish the Student Emergency Relief Fund, providing urgent support to students in need. It's made a huge difference in students' lives, and that is thanks to you, our alums. We're really grateful to you for all of your help. One message I take away from this spring semester, I guess, is that of the importance of being patient and being forgiving. We had to make a huge number of decisions in very short order. They weren't going to be perfect just by the nature of how quickly we had to act. And I think we all learned to accept that, to let it go, and above all, to create a culture where admitting mistakes is okay. Admit what we did, acknowledge where we went wrong, learn from it, and fix it together. It's a great community for that kind of thing. The other thing I drew from this semester is the need to seize on these events to galvanize a re-envisioning of the future. While the obstacles we face are enormous, so is our determination and commitment to positive social change. Columbia School of Social Work not only provides the workforce to pursue needed change, it also provides the evidence base to inform better policies and practices in social work. At no time in recent memory has the need for social workers and social work thinking been greater. We have to be ready to act. And I'll have a few updates on that front too in a moment, but I'm just going to talk a little bit for now about the fall semester because I'm getting a lot of questions about that when I engage with different folks. For the last few months, of course, we've been thinking very actively about what the fall is going to look like. Now, there's a whole range of options out there running the gamut from fully on site, back to normal, no problem, to fully online, depending on public health conditions. After much careful consideration and deliberation, we decided to offer our education in a hybrid format this fall, primarily online, complemented by a selection of small group on-the-ground activities, including small classes. This includes field placements as well, which will be primarily remote in the fall, taking advantage of new technologies and new digital platforms that I think will set up our students very well for what social work looks like in the future. Now, regarding the New York campus of Columbia University, university leaders have been carefully planning and executing a layered or multi-stage response to how to come back to campus responsibly, considering the order of events, the timing of events, the character of events. Safety will come first above all. There has been a lot of central communication and guidance. The provost has coordinated 3 key committees focused on education, on research, and on facilities. And in addition, those 3 committees interdigitate with 2 other committees, one focused on public health and one focused on finances. And I have to say it's a huge advantage to be at a big university like Columbia, where we have really deep bench strength in all of these areas. Those 5 committees I've just referred to all report to a single COVID-19 task force, which reports directly to the president. There has been a tremendous need to maintain really open communication between all of our units and schools at Columbia, and that's for everyone's safety and everyone's sanity, really. There's a lot of careful choreography going on in the background, and that's because we're one community, and what one unit does will affect the others, and so that coordination is critical. Now, thinking about the fall, we have some plans in place. We have to be prepared for dramatic changes midstream, mid-semester, no matter what we plan. And how do we best do that? It's by thinking of different scenarios and different contingency plans. And we've done all of that, taking really careful account of what could happen and where we go from here. We will be ready, and we are ready. So the last thing I want to say before I turn to our exciting conversation with Dr. Alcántara is that these events have prompted some new developments at Columbia Social Work. And these developments make me really proud. Here I'm going to refer to the action that I mentioned earlier. I'm going to share just a couple of things that have happened over the last few months. Back in March, when COVID was surging in New York City, a group of our students and faculty came together to form COVID-19 Action, a group seeking to provide resources, psychoeducational training, and a volunteer matching service to individuals who wanted to help address the consequences of the COVID pandemic. After the brutal murder of George Floyd and too many others, and the ongoing protest movements that followed, the group pivoted to become Action Lab for Social Justice, maintaining its program focused on COVID, but also adding a new initiative called Action for Black Lives. This has given us the idea of establishing the Action Lab as a formal entity with the mission of focusing on scholarship around social justice and social welfare actions, policies, and programs. While centered in the School of Social Work, our aim is to build a broad coalition of faculty, staff, and students across the university who share our commitment to community justice, economic justice, health justice, and racial justice. Another example is Social Work Votes. Here, a group of students and faculty came together to support voting rights. This nonpartisan group supports the right to vote, since voting is a tool to fight for social justice. They have a newsletter, they've got a podcast, a website with resources. It's all very interesting. I encourage you to look it up. And then finally, a very important example of how social work contributes to the university at large. The Provost's office approached us to offer a university-wide mini-institute on addressing anti-Black racism for all Columbia faculty. 4 of our brilliant faculty came together to put together a 3-session series with the support of our wonderful Office of Diversity, Equity, and Inclusion and support from the Provost's office, and invited faculty to apply from across the university. So they've had their first session. There are a couple more sessions coming up. We're really proud to be driving this initiative based on faculty expertise in PROP, power, race, oppression, and privilege education, and on the anti-racist scholarship that occurs at Columbia Social Work all the time. So that's what's been happening at the school. It's now my pleasure to change gears and turn to the main event. It is my great pleasure to introduce Professor Carmela Alcántara. She is Associate Professor and Director of the Sleep Mind Health Research Program at Columbia School of Social Work. A licensed clinical psychologist by training, with expertise in public health and behavioral medicine. Dr. Alcántara's interdisciplinary research is really broad. It encompasses psychology, public health, social work, medicine, to understand how structural and social factors affect sleep, mental health, and cardiovascular health, particularly in marginalized communities. She's an exceptionally productive scholar and a talented mentor. Dr. Alcántara has worked with colleagues across the university to explore the link between sleep patterns and physical health, and to identify the conditions that prevent underserved populations from achieving good sleep hygiene, looking for ways to provide the necessary resources and supports to reduce disparities in this range. In addition to her really wide and important research portfolio, Professor Alcántara serves as chair of the school's doctoral program. She's also a faculty affiliate of the school's social intervention group and of the Columbia Population Research Center. She has authored and co-authored innumerable papers and book chapters, and her work has been supported by the National Institutes of Health, the Robert Wood Johnson Foundation, the Kellogg Foundation, as well as the Irving Institute and the Office of the Provost right here at Columbia. Professor Alcántara received her bachelor's degree from Cornell University and her MA and PhD degrees from the University of Michigan. Prior to joining us here at the School of Social Work in 2015, she was a research scientist in the Department of Medicine right here at Columbia as well. Dr. Alcántara greatly enhances our educational and research mission and is a treasured member of the school's faculty, indeed of our wider community. Carmela, I'm delighted to welcome you here today and to engage you in conversation with our alums to listen in. So I'm going to start at the top. Congratulations on your tenure. Carmela was tenured during this spring semester, very deservedly so. What's the first thing you did upon hearing the news that you'd gotten tenure?
Yeah, thanks. Thank you, Dean Begg, for this opportunity to chat with you and for our school for putting together this series. I'm really delighted to be talking with you and the audience members. I see lots of familiar names among the participants, so it's exciting to reconnect with you all and hope you're healthy and safe. I still remember the tenure news. I was delighted, or I was lucky that it happened pre-COVID and that the news was delivered personally by you and Dr. Tytler. And so I remember I was filled with emotion, and I'm a hugger. So I was definitely, and you probably remember, there were lots of hugs to be shared. And after, that immediate reaction, I went ahead, of course, and called my husband, I called my parents, I called my siblings, and then of course my treasured mentors, because they're the people who are with you and who invest in you across all these, both personally and professionally along the way. So wanting to make sure that they knew the good news. And even now, it's been 4 months since it was official. It still feels surreal. I think part of that is, this is something. Achieving tenure has been a lifelong career goal, and especially as a first generation person. So I'm the first in my family to graduate and go to college and PhD in academia. And so this is really just in some ways unimaginable then. But one of the greatest memories I have was calling my mom and in the emotion, trying to find the right words to explain what tenure means. And I couldn't really. And so I said, Mom, I have a job at Columbia for life. They can't fire me, it's close to that, right? So I still.
Indeed it is.
Yeah, I still take great joy in that memory.
That's great. And I remember the hugging. Glad we were able to do that back then.
Yes.
So.
Yes.
As we talk about your work, which we're going to dive into here, it's clear it has a very interdisciplinary character to it. Could you please take a moment and just sort of describe for everybody the breadth of your academic interests, where they lie, and tell us how your path evolved to take you to this point?
Yeah, and I think you did a great job of just describing where I've been, and in some ways it's the art of academia where you hear a bio and it sounds very linear, but in fact we know that it's much more windy than that, right? And so for me, I've always been really interested in how the effects of culture and other contextual factors on lived experience, and that's why I went to graduate school, was to really understand how culture intersects and affects psychopathology, and spent a few years there being trained by psychologists, community psychologists, clinical psychologists, and social workers actually in how to study culture and the intersection of culture and mental health and physical health. And it in a clinical psychology PhD program, you have the research component, and then you also have the clinical component. And so after spending several 5 years at Michigan in Ann Arbor, I decided to do my clinical internship and come to New York. So I actually was at Bellevue Hospital here in New York City for a year, really excited to apply all this great clinical learning to, the communities that I'm really passionate about, including Spanish-speaking individuals and immigrants and those from lower socioeconomic status, and then really realize just the limitations of that, in that you really can't do clinical work without understanding the contextual factors and the socioeconomic factors that affect people's life. And so that's what really led me to want to study and understand how social determinants affect mental health and affect access to health services and affect physical health. That I was there, here I am at Bellevue, really trying to help the most underserved populations equipped with the best clinical training, and yet you're talking about issues of housing insecurity, you're talking about issues of poverty, you're talking about issues of community trauma, and it felt like there was something missing from that from my training that was really focused at the individual level, which led me to public health and to social epidemiology there. But it was interesting. So I spent 2 years there, going from one end. So I went to sort of individual, really micro focus, even thinking about culture, to then thinking about population level, and how broad social factors and poverty and socioeconomic status affect health. And after those 2 years, felt like, okay, well, it'll take a long time to implement, to make policy changes and to really address upstream factors. And so there's value in the individual. And at the end of that experience, really being afforded the perspective of thinking about upstream level factors or population level factors, and also the importance of individual work. And so my work so far has allowed me to, on the one hand, have a research portfolio that's observational, that's focused on describing how social determinants affect mental health, sleep, cardiovascular health, some of the outcomes that you had talked about before. And then at the same time, to really think critically about how do you translate those findings, those social epidemiological findings, into clinical interventions. How can you then develop clinical interventions that will be maximally effective for the communities that you're trying to serve? And a lot of my work has focused on racial ethnic minority communities. I've done a lot of work in Latino immigrant health communities, and I know we'll talk a little bit more about some of that current work. But I think it's been a challenge, and it's made for this windy path with lots of years of training from, I think, not start to finish, but from start to this point. But I think it has allowed me to be able to zoom in and zoom out in a way that only interdisciplinary training can and collaborations allow you to do.
Yeah. And it sounds like you're nimble in your thinking, right? You were looking and observing as you went along the way. And that sort of is, I guess, is the impetus for those turns where you see a need.
Yeah.
Very social work concept, I think. I know you put a considerable amount of your attention and your research on insomnia. What makes insomnia and other sleep problems major public health issues?
Yeah, that's a great question. I know we thought of a little of a poll, and Jen, before I answer that question, maybe we can turn to the poll, because I'm curious what the participants on in today's conversation, what their sleep patterns are like, and then hopefully this can serve as a mini intervention. Maybe the answer to your question might prompt some behavior change. So if you all see here, you have a poll that you can take about how many hours of sleep per night are you usually getting, and you can feel free to answer honestly. There's no judgment here. It's just some psychoeducation. And then Jen, maybe you can tell us Jen March, you can tell us the results of that poll. Oh, interesting. Yeah, it just flashed up and then it went away. But I think what I saw is that there were about 38% of people who were in that in the 5 to 7 category,
Yeah,
which
that's
is
what I saw too.
which actually fits quite well with what you tend to see nationally, which is that about 1 in 3 adults in the United States will report not getting enough sleep, or the recommended amount of sleep per night, which is 7 hours. And what we know is that this insufficient sleep and other sleep disturbances like insomnia are associated with increased risk of death, increased risk of cardiovascular disease, cancer, diabetes, depression, and work absenteeism, their loss in terms of work productivity. So it also not only has a public health burden in terms of physical health burden, but also an economic cost as well. And so, those we have national guidelines, and in fact, improving sleep health at a national scale is one of the objectives for Healthy People 2020 and Healthy People 2030 as well. We're not meeting those goals as a country. In fact, we went in the opposite direction. We didn't make any gains in terms of increasing people's number of hours that they slept per night. People are actually reporting more sleeplessness now than they did when they started this objective. So there's more work that needs to be done in terms of improving the country's overall sleep health in general.
Yeah, I'd been aware of your work on insomnia and cardiovascular health. I had no idea it affected all those other areas of health as well. It's really quite broad and all encompassing.
Yeah.
What kind of treatment options are there for folks who suffer from insomnia now?
Yeah, there's a lot of reason to be optimistic when it comes to insomnia, because we actually have some excellent treatments that work well. We can't say that for all conditions, but we can say that for insomnia. And broadly in treating insomnia, there are pharmacotherapy options, some medication options. There are also behavioral options or psychotherapy related options for treating insomnia, and also some of what we might refer to as lifestyle changes. And so this includes some of the sleep hygiene or sleep education that you had alluded to before, where with insomnia, I say that we're lucky because we have behavioral treatments that have been shown to work really well and to be really effective and superior for treating insomnia in the long term compared to medications. In fact, it works so well that it's the gold standard, and it's what American College of Physicians recommend as the first line of treatment. And that, for a behavioral treatment, that says, within a medical system, that's the recommended line of treatment and first line of defense. It says a lot. So there's lots of good treatment behavioral options, particularly cognitive behavioral therapy for insomnia. Though there are some access issues. So we know what works really well, but there are not enough providers who are qualified and trained to deliver that treatment. So there is this accessibility issue and
gatekeeping kind of thing. Yeah.
Right.
Yeah. So I know you're doing some really interesting work now. You have a grant that's focused on digital therapeutics and insomnia in Latinx communities. Can you tell us a little bit about that?
Yeah, happy to. So I was just alluding to that supply and demand issue in terms of, we know a lot of people suffer from sleep problems, suffer from insomnia. Insomnia, like sleep disturbances, is also common, with about a third of the population reporting some kind of insomnia symptom at any given point, including difficulty falling asleep, staying asleep, and early morning awakening. What's interesting in the case of insomnia is I'm a big champion for behavioral treatments. I know many of us listening in are as well. And what's interesting with insomnia is that there's this digital therapeutic space, which is really referring to, it's like a fancy term that's referring to internet facilitated, facilitated or digital facilitated treatments. Typically, these are self-guided treatments, so people can complete them on their own. And there's been a lot of research to show that for digital versions of cognitive therapy, behavioral therapy for insomnia have been shown to be just as effective as face-to-face cognitive behavioral therapy for insomnia. So there's a lot of promise. There's been an exponential growth in this area, particularly in the last 5 to 10 years. And the grant that currently working on right now, along with colleagues at the medical center here at Columbia, is to take an existing digital therapeutic for insomnia, and I actually have partnerships with Pear Therapeutics that created what's referred to as Somrus, which is an FDA-approved digital therapeutic, the first ever for insomnia, which is exciting. And what we're doing is taking that, applying a really rigorous cultural adaptation framework, adapting it for Spanish-speaking Latinx primary care patients, and then testing it in a randomized controlled trial to see if this rigorously adapted digital therapeutic for insomnia is effective at improving insomnia symptoms compared to usual care in Latinx primary care patients. I get, in addition to that, so there's this adaptation component and testing component. Right. We're going to do this almost like a 360 multi-stakeholder evaluation, where we're going to talk with patients and providers and stakeholders to see what are the barriers and facilitators to implementing this kind of digital therapy in primary care, and then lastly to see if it's cost effective. With digital therapeutics, so much of that work has happened with high socioeconomic status. So, folks with a college degree or older, mostly with English speaking communities. So this is the first of its kind, which is exciting. It has its own challenges and opportunities as well. But I think there's a great opportunity here to learn, can we do this? Can we do it in a culturally sensitive way? Can we test it? And if it's effective, it has a lot of implications for expanding access to treatment.
Yeah, I like the fact too that you're focusing in particular on the barriers and facilitators to the implementation, right? If it works, great, but we can't convince people to adopt it. It really can't do us any good. And do you have a reason to believe that this is going to be particularly effective for Spanish-speaking Latinx populations compared to, you're making this important distinction of where have we shown these things work before, and how do we make that transition? What's your thinking on that point?
I think that it's a great, opportunity. So we know that this digital therapeutics, particularly for insomnia, work well. And we know that adapted treatments, culturally adapted treatments, particularly in other use cases like for depression, result in greater adherence to treatment and better outcomes. So if we apply those two principles, at least we have, or that background literature, we have a good hunch that an adapted treatment should result in improved outcomes. But the truth is we don't know that there is equipoise here. We don't know. We hope,
Genuinely don't know, so it's ripe for a trial. Right, this is where a trial should be conducted.
It's ripe for a trial and ripe for gray hairs.
Yeah. Right. Yeah. So I think it's fair to say that that you were a proponent and engaged in community engaged research, and I'm wondering what does that term, community engaged research, mean to you, and how does that work its way through your research? How is your research specifically community engaged?
Yeah, it's such a good question, because when I think about community engaged research, I go back to some of my graduate roots where I learned community engaged research from my dissertation mentor, who's a community clinical psychologist, and also I had several social work mentors at the School of Social Work at Michigan, where I was going and building connections and driving with these PhD mentors to Southwest Detroit to get to learn and establish relationships with the community agencies that I later went on to work with for my dissertation. So I think of community engaged research as like residing along a spectrum. And, at one end, there's at its simplest definition, it's doing work with a community. So leaving the confines, and this is especially true in psychology, where there's a lot of research that happens with undergrad populations or even sort of graduate populations. And so that community research is going out into the community, into the field. So if it's adults or children who are not members of a college population, to the other end of the spectrum where you have community-based participatory research, where really it's community drivers who are leading that research. And even within that, that's an approach that has a spectrum as well. But for me, I see myself as lying probably in the middle, where my work involves and leverages a lot of community input, a lot of community involvement in the in the outcome and the interpretation of data, but it's still from the perspective that the research questions are originating from, informed by previous work, but originating from me as the researcher. So I sort of see myself as lying in the middle of that spectrum, where even in this project, we have a community advisory board that's informing all the development of this project and really active, which is great. We had our partners from the digital therapeutics firm were really surprised to see how active of a community advisory board we had, because our patients were participating, our patient stakeholders, the provider stakeholders, the broader, insomnia expert stakeholders were all contributing. And it's important too that for me that we conduct our community advisory boards in English and Spanish. And so that presents its own challenges, but we've been able to successfully do that. And I think that's, again, consistent with this community engaged research approach that I think is just so important.
Yeah, yeah. So on that same note, I've often heard the charge that when you have academics doing community-based research, that there isn't a lot of attention paid to delivering the results back to the community that is most affected. Is that something you try to manage or put particular focus on? Because it seems like that's a big gap that has created some ill feeling, right? Understandably over the years. And I'm just wondering how you address that issue.
Yeah, I think that's such a great point. And trust is a really good word to use in describing that. So that is part of the work that I do. So for other research that I've done, we make sure to get the results back to the community, whether that's directly. So for some of the work, we'll send reports of, this is, not just thinking about the data when you're analyzing the data as a whole, but even their own individual data, which participants are really curious about and want to get. So how can we empower them with the information that we're collecting? So definitely that's a great point and a great model, because that continues to build trust. And I think I along with team members, we've been successful in really building up a research base from the ground and collaborations with consulates, because there is this constant exchange of information, and the information isn't just staying with us, and separately, becoming a reliable and consistent presence in the community. So we'll do, participate in public health fairs, even if there is no data collection affiliated with it, but it's really, again, providing community health education or health education back to the community. So that's been really important, that we're establishing a regular presence, so that you are building the sustained trust in the community. I know that you're not in it just to collect the data and go, but that you're in it to work towards improving community health broadly, and also making sure that you're empowering the communities with the data you're collecting.
Yeah, thank you. Really critically important. I'm going to pivot now and tie in something I was talking about earlier that's affected all of our lives, and that is the COVID-19 pandemic, right? Which had effects all around us. What does the current science tell us about the effect of COVID-19 on sleep?
Yeah, this is also a great question. And Jen, if you don't mind, we do have a poll, another poll for our participants to take, which is related to this. And so I'll let Jen, yeah.
Okay.
And so the question is, everybody, how has your sleep changed in light of the COVID-19 pandemic and racial justice uprisings? And you can select all that apply. And so we'll give you a moment to respond. And then I think we'll be able, and then here, so here are the results of that poll. It looks like 40% of folks said I've had a hard time falling asleep. 20% of people had said I have a hard time staying asleep. 20% I feel restless at night. It's hard to stay still. I feel restless at night. It's hard to quiet my thoughts. No one's saying that I'm sleeping harder than I was before. People are saying 40% have said I'm more tired than usual, regardless how much I sleep. Although 30% of people had said they haven't noticed any changes. So by and large, 70% of folks who are participating today have said that they've experienced some changes. And it's interesting because with COVID, there's been some writing about what in the behavioral sleep medicine community about COVID-somnia, which is the acute effects of stress on insomnia symptoms, particularly during the pandemic. And there's been really great work coming out from Columbia, actually, from the medical center about the effect of the pandemic on New York City healthcare workers and their reported sleep. So about maybe it's closer to 75% reported insomnia symptoms. And so these were healthcare workers at NYP who were surveyed in April. So during our New York State's peak, right, surge. And so insomnia is one of the most frequently reported complaints or disturbances, in addition to psychological distress, but insomnia has come up. This is also true from research coming out from China as well about the effects of the pandemic on sleep. And part of that is that we know our routines, and particularly, at the beginning of the pandemic, still now, but have been completely disrupted, and the routines then affected the people's sleep and wake times. And so what it's resulted in is these irregular sleep and wake times, which is then contributes to a lot of this disrupted sleep that we're seeing now. And so you have that in addition to the increased stress, the uncertainty that people are under. The lockdown in some cases might have prevented people from getting exposure to light during the time being outdoors during the time of day that they typically would have been outdoors, which actually helps you build that sleep need. So that complete dysregulation of people's typical routine, just in terms of their work, in terms of their eating patterns, just completely affects and disrupted people's sleep patterns. So there's some strategies for dealing with that acute, with COVID-somnia. There's including getting exposure to bright light, 30 to 60 minutes ideally after you wake up. That's actually an important tip, trying to manage trying to manage your stress. And it's so much easier said than done, and I hear this all the time, but keeping that consistent sleep schedule as well. So trying to go to sleep and wake up at the same time is one of the biggest recommendations, yet one of the hardest things to do.
Yeah, for sure, for a lot of us.
Yeah.
I have more questions here, but I see one in the Q&A. Oh, just disappeared. Let's see, I've got it. All right. Can you please give us some examples of the digital therapeutics that you referred to earlier and how you use those?
Yeah, happy to do that. Thank you, Francis, for your question. So for the grant that I'm currently working on now, it's testing the digital therapeutic that's called Somrest. And it sounds like a medical, it does sound like a like a pill, like
Yeah,
a medication. And I think like a drug. And I think that was intentional by the developers. We're actually asking in our focus groups about the name because we're curious to hear what that said. And the evidence base for Somros is actually quite strong compared to other products. So they have tested it and have followed people, have compared this digital therapeutic, which all that means is that it's in this case, it's a mobile based, so it's an app based CBTI program, cognitive behavioral therapy for insomnia program that really tries to mimic, include the content that's discussed in person in face-to-face cognitive behavioral therapy for insomnia, but has all of the content in an app with, following the principles to make it interactive and interactive across a 6-week time span, but really preserving all of those key ingredients that have been found to be effective for treating insomnia. And so, it includes, it's addressing, it's psychoeducation, it's addressing sleep hygiene, it's addressing sleep restriction, which is a key component, some work on, maladaptive thoughts, and in all the while also helping people track their sleep, and it offers then personalized recommendations. So what's great, the reason why I was really excited about this digital therapeutic is because it's been tested, it's been shown to be better than just sleep education for improving insomnia, and that these effects are actually sustained even as far out as 12 months. And so if there was a best case example to test example to use, a test case to use, I think Somros is one of those.
That's excellent. Do you have other tips for us? You started to say, getting 30 to 60 minutes of sunshine early in the morning and trying to keep to a consistent sleep schedule. Are there other things we should be targeting to improve our own sleep hygiene?
Yeah, there's so, and you mentioned the COVID action, and we actually did a COVID action talk just last week on strategies, just like the behavioral strategies to improve sleep health. There's many. I think that keeping a consistent sleep schedule is one of the most important ones. The bright light. Sometimes, minimizing when you consume caffeine. And so typically the recommendation is that you want to have like your last cup of coffee or caffeine, like we like to say 6 hours before your bedtime. So you can kind of work backwards to see what that results to. Another big tip is, it seems very intuitive, but people don't actually do it, is that if you're in bed and you're not sleeping, to actually get up out of bed. So if it's been 20 minutes and you're still tossing and turning, it's actually good to then get out of bed, go
really? I never would have thought that.
Yeah. Get out of bed, go to another room, do something relaxing, and then come back when you're sleepy. Because part of what happens actually is that what you're trying to do in this treatment and in general is that you want to really condition or recondition your body that your bed is only for sleeping or only for sex. Actually, those are the two main activities. And if you're hanging out in your bed, you're working against that, that conditioning. So that's a big one that often doesn't get implemented. But, monitoring caffeine intake, monitoring actually when you exercise. So sometimes people feel like, I really want to exercise, like, and fatigue my body and go to bed. But if you actually want to exercise, like the latest you can exercise will be 2 hours before bed. So you don't want to exercise within 2 hours of going to bed. That actually gets you more activated. And then limiting substances, that's the other part of the COVID somnia. We know that there's been research to show that people are using more substances, like alcohol use has increased during the pandemic than not. And we know that actually, alcohol, it might help you fall asleep, but it has this rebound effect and then gets you so that you wake up in the middle of the night. So also monitoring how much you're drinking and when you're drinking can help improve your sleep.
Thank you. I think a lot of us were taking notes just then, so we appreciate it.
Sure.
I'm going to invite folks to please use the Q&A to submit more questions. And I see I'm getting some separately as well. And One is for me, Carmela, so I'm going to
Yeah.
do this one, but talking about what's all that's been accomplished in the past year, and what's on the wish list for the coming year. So I can answer that quickly and then turn it back over. But I think I really want to emphasize the interdisciplinary partnerships. I think we're all hearing from Dr. Alcántara power and strength that emerges from interdisciplinary work. And I think better integrating our social work thinking throughout the university is big on my list. Also, just taking a look at our educational programs again. We're up on for our accreditation, so we've been starting work on that, thinking about how to innovate and improve our education all the time. It's a dynamic thing. If you're sitting still, then you're falling behind. So we always have to be mindful of doing the latest things with education. Also coming up, I think, with outside of our degree programs, educational opportunities for alums and for people who are even outside the field of social work, for whom social work thinking, I think, could be really important and could improve the work that they do. So we've been thinking along those lines. And of course, scholarship funding, that's really been first and foremost in my mind. We have a fantastic school, fantastic faculty, fantastic students, but we need to work on access, and being able to raise funds and increase that scholarship pool is very much front of mind for me, because that will make us accessible to all the best students in the country who really are committed to our social justice mission. So that's where I see us going with respect to the school. And more questions coming in, which is great. So for you, Carmela, are there intergenerational differences in terms of sleep and how we're being affected by the COVID-19 pandemic? That's an interesting question.
Yeah, thanks for that. Thanks for that question. I think we do know that there are life course differences in how much sleep people need. And so, how much sleep a baby needs versus an older adult or into adulthood. I think one of, just going back a little bit to that point about COVID-somnia, and there's been less research on children's sleep during the pandemic, but what we do know is much like their routines have also been disrupted, including less outdoor playtime and particularly just those sleep routines that, having to go to school and sort of having a consistent school schedule helps promote in some ways better or good sleep hygiene for kids. And so while there isn't any data, so I can't point to any specific study that has actually looked at the effects of the pandemic on children's health, we also know that they have been affected as well in terms of sleeping shorter, having more disrupted sleep, et cetera. We do know that this issue of, and this is getting a little bit to your question, but not quite, but we do know that when we look historically at how much sleep is the country getting over time, we know that actually, this sleep health crisis is worsening over time.
Right.
And so you see that, a greater percentage of people now are reporting insufficient sleep or sleeping less than 7 hours than they did back in 1970, for example. So the problem's only getting worse over time.
I didn't realize that. I see another question. What are your thoughts on the use of melatonin? What is too much melatonin? Can it be harmful?
It's interesting because I think that there's been some systematic reviews on the effects of melatonin and lots of individual differences that you hear anecdotally too, that some people will say that they've had positive effects of melatonin. I think one thing that I will say is that it's not meant to be used as a daily supplement. Like sometimes people will use melatonin if they're traveling, from one coast to another because of the changing time zones, and it's supposed to facilitate or help your body adapt to the new time zone. But it's not meant to be used as a substance that you're using all the time. If you are finding, for example, that your sleep problems, if it's insomnia or other sleep issues, are more chronic, that looking into these longer term solutions or some of these behavioral treatments that we talked about would be helpful.
Thank you. I see another question on the digital therapeutics end, on the technical end. How do you think about the tension between free apps for wider access, usually paid for by ads that you then have to watch, or perhaps also sacrificing personal data forever, versus paid apps with more security, but which still could grab your personal data forever? So what are your thoughts in that realm?
I think this is such a good question around, data security and also digital literacy, because I think that there's a lot of, there's just so much information. I think the extent to which people are process how much of their data they are sharing or not. So I think this data security, digital literacy question is its own area of inquiry on its own, and I'd be curious to explore that in focus groups. For this particular project, part of what I get excited about and why have partnered with this specific digital therapeutics firm is because their product is FDA approved, and the idea is that it's a prescription-based digital therapeutic that can then be covered by insurance if it's prescription-based. And so that's if it is effective, it does have far-reaching implications for access. It doesn't. I think it. I'm not answering your question directly. I think there's more work that has to be done around, like, how do you how do you do this work around digital therapeutics and being attuned to issues of digital literacy and health literacy, and provide the information back to patients and participants in a way that is accessible and empowering too, so that then they're making decisions. I think that's an important part of an important piece of the research puzzle. So thank you for that.
Sure. I know we're going to have to wrap up soon to respect folks' time, but I did get one other question about screen time. Here we are on our laptops meeting. This is what we need to do during COVID, but how does screen time fit into the picture with respect to sleep and insomnia?
Thank you. I didn't go through all the exhaustive lists of sleep hygiene tips. Limiting screen time is absolutely one of them. And with the COVID pandemic, actually what we found—
Hard for a lot of us.
Yeah. Oh my goodness. And what we found, what has been shown is that, it's this nonstop news cycle, and the information, the news, information is everywhere. So just consumption of news is at an all-time high, and typically you're consuming information on your mobile phones. And so limiting screen time is really important. I'll just sort of include or mention two tips as well, which, part of it is creating a sleep routine as well. So we do this with children. It's very intuitive to help and teach kids to learn how to sleep, is to create a sleep routine that then, serves as markers of what happens next. But as adults, sometimes we lose that. We forget that we also need those markers. And so I bring this up in talking about screen time because as part of this effort, in creating a sleep routine where you're telling yourself, okay, I'm going to stop checking my phone 30 minutes before bed, and then have this set sleep routine, and or have not have your phone right next to your bed, so that if you wake up, you're then looking at it right away. And so that screen time and that exposure to that blue light actually from your phone has been shown to disrupt your sleep. So it's really the body is this amazing thing where even light exposure, right? So you want to get light exposure at the right time of the day, and you want it in the morning to help to help train your body and build up that sleep need. But if you get it late at night, even from your phone, that also leads to that disrupted sleep. So that screen time is important, and that bright, it's that light exposure that is tied to that.
Yeah. We're going to have to wrap up. If there's one takeaway you want us to leave this conversation with, Carmela, what would it be based on your research and your studies?
Yeah, thanks for that, Dean Begg. I think one, I'm passionate about thinking about sleep and understanding sleep health and sleep disparities. In other work, we've shown that sleep may actually be a mechanism by which by which cardiovascular health disparities arise. And so I say that to just underscore that hopefully you are leaving this conversation thinking more deeply about your sleep, that you're thinking, that your sleep should be as vital as the way that you think about water, right? You wouldn't go a day, I say this in the past, but you wouldn't go a day without drinking water. You really shouldn't go a day without getting sleep. And I would implore you to sleep, to strive to get that recommended 7 hours of sleep. And then because of all the work on sleep disparities, just remembering that sleep is also a social justice issue. I think that's partly why I'm out of school of social work, and it fits, and we could be all motivated. It is an individual level behavior, but we know a behavior that's shaped by these structural factors, and that it's quite powerful if able to modify it in terms of improving health. And so again, just wanting to leave with that message of sleep is as vital as water. It's essential for your health, and it's a social justice issue.
I love that. It is a social justice issue. What a terrific session. Thank you so much, Carmela. And congratulations again on your tenure and all the wonderful work that you're doing. And thanks to everybody for tuning in and for the excellent questions you submitted. We're really grateful. I'm going to turn it over to Jen at this point.
Thank you, Dean Begg, and thank you so much, Professor Alcántara. This was a wonderful program. I've certainly learned a lot about sleep, and now have to start practicing some of those tips that you gave us. I want to thank everyone in our audience for joining us this evening, and thank you for all the great questions that we had for our speakers tonight. As a reminder, I want to let you know that our next event with Dean Begg will be Monday, August 17th at 3:30 p.m. Eastern Time. And we're hoping, that some folks on the West Coast can catch us during that as a convenient time. Invitations will be arriving in your email in the upcoming weeks, so please be on the lookout for that. Thank you again for joining us. We really appreciate it. We hope you enjoyed the program, and have a great evening. Good night.